Hello everyone, this is Kitty Clinical here with another video, and today we're going to be talking about hiccups. More specifically, the persistent hiccups or intractable hiccups, those that you cannot control, those that are worrying enough for the patient to come to see you in the clinic or the office, the outpatient setting. And what you want to focus in on here is whether or not there are any red flags. That should be the first thing that comes to your mind when you think about hiccups. Are there any neurological symptoms? Was there any history of trauma? Is the patient hemodynamically stable or unstable? Do they have a history of cancer? Do they have a history of drug use, cocaine, heroin, alcohol abuse, all those things, right? So if they do have some of these things, this is where you gotta dig a little deeper. So, obviously you want to check alcohol levels, salicylates, bromine. If they have a history of cancer, you might want to consult hem-onc for this. If they've not already followed hem-onc, you may want to consider imaging them again to look for any metastasis, because of course that could be one of the first things that comes to mind when you think of a cancer patient with intractable hiccups. If they're not stable, if you feel like they're not breathing well, their vital signs are all over the place, then you want to start thinking about the resuscitation pathways. You want to treat the underlying cause. Trauma, you want to look for, you want to protect the airway, of course, breathing, circulation. Excuse me. And then you also want to consider brain imaging. Neurological symptoms, you want to consider imaging as well. Perhaps later on, if you feel like there might be a sign of infection, then consider a lumbar puncture as well. If none of those are there, if there's no red flag symptoms present, then there are things that you can do. Specifically, you can try physiological maneuvers, having them hold their breath, having them maybe extend their neck, sitting down, maybe drinking through a straw with their ears plugged. These are all things that we can probably try to do. If none of those things are successful, then if they are successful, you can try keep doing them as needed. But if they're not successful, then you would want to consider there's a whole lot of things that you can do. So for GERD, I'm obviously one of the first things you think about when you think of hiccups is GERD. You can just give them Protonics, maybe Pepsid. You can also trial them on if you can also trial them on metoclopramide or Reglan, Haldol, chlorpromazine, Baclofen. You can also think about if they're bloated, you can think about simethicone, which is a very common one for gas. If it's alcohol related, you can think of Angostura bitters. Now, if you give them, let's say you give them a PPI and it's been working, then you can try to stop it and kind of reassess for returning of symptoms. But if they're still not getting better, you want to look at their kidney function, and if their kidney function is normal, maybe change to Baclofen or gabapentin. Gabapentin is actually really good for hiccups. I don't know if you know this, but gabapentin has been one of the things that I've given patients for intractable hiccups. In fact, that was something that I came across a lot while I was a resident. And if their kidney function is not good, you can consider changing to amitriptyline. If there's not an adequate clinical response, you can also consider nifedipine, valproate. You can also think about olanzapine. Remember that olanzapine, that can cause some weight gain. Pregabalin or Lyrica. You can also give oral lidocaine 2%. You can also try things like acupuncture and hypnosis. But you also might want to consider consulting GI as well if you have no idea what's going on. Hiccups is such a broad topic that there's so many things that you can do. But I hope you enjoyed this video. I hope that you learned something from this talk. If you have any questions at all about hiccups, I'm all for it. I'm here to learn more from you all as well. And if you enjoy any of this content, you're welcome to share it and like and subscribe to my channel. I will see you all in the next video. Take it easy. Bye.